that everyone dreads to see for last. You know who you are. Everybody will be coming down the hallway and they'll go, oh, I don't want to see you. But all of the tests that I do are tools to help us to know your lung function. As you know, ALS is a progressive neuromuscular disease, and the level of respiratory support will increase over time. The forced vital capacity, the negative inspiratory force, and the peak expiratory flow are just a few of the tests that help us to know what different types of equipment we need to implement and when to do it. As the lung muscles continue to weaken and atrophy, the FVC decreases. It may be better in the sitting position than in lying down. And when you first come to the clinic, we do both sitting and supine. And typically, the supine test is lower. You may observe some symptoms like breathing too shallow, hypoventilation, which can cause your carbon dioxide levels to increase. This could cause you to wake up with headaches. These are some of the things that you don't even think about, and you just push them away. But those are questions we ask because it does have relevance to what we do and what we're going to order next. It can, hypoxia, that can decrease your oxygen saturation. You may feel tired or can't think as clearly as you usually do. And you may not even notice it. It may be your spouse that notices that. And you may even be yawning a lot during the day. That's something that tells us you may have atelectasis. That's where the little tiny air sacs at the base of your lungs will close up because you're not breathing deep enough. And if you don't breathe deep enough, then you can that's when the respiratory infection can start. And that's the last thing you want to do is get an infection. When all of this happens and your FVC decreases, or your NIF or the PEF, it tells us which type of machine that we need to implement. The non-invasive ventilator is one of the ones that we try to get going as early as possible. This one is the one that studies have shown that if we can implement it early enough and you get using it, it can increase your quality of life as well as life expectancy. I had slides, but I'm gone way ahead of them. Anyway, when you yawn, that's your body's way of trying to keep those alveoli open. So we try to get this one, the trilogy. How many of you in here has a trilogy? Looks like a lot of you. So everyone knows what it is. It's this machine here. And the reason that we choose the trilogy over other types of invasive machines, it has a lot more bells and whistles on it for the respiratory therapist to be able to assess you and titrate the settings more comfortable for you. Each therapist that comes out, each one of you are different. So it may take a longer rise time to make you comfortable, or the inspiratory time, or you may need more of a tidal volume than someone else. So the key is the respiratory therapist coming out, doing the assessment, listening to the lungs, and getting you set up with this machine. Now, a lot of the things that people say, well, I don't want it, and they want to turn it in. Please don't turn it in until you've already tried all different kinds of interfaces, because that's one of the things that's important. If you don't get the correct interface, which is either the mask or nasal pillows, they have total face, ones that go over the nose and the mouth, nasal pillows that you can use a chin strap, which at night we would rather you have something over your nose and mouth, because your mouth tends to fall open, and then the air takes the path of least resistance and comes out your mouth, and it's not doing your lungs any good. So the interface is a really integral part of getting you comfortable on this machine. The therapist, they'll work with you, they'll give you time. It's not like, oh, I have to put this on, I have to wear it all night long and lay there awake, you know. Put it on. If you can go to sleep, sleep as long as you can. Take it off when you wake up. If you can't go back to sleep, put it back, take it off the next night, put it on again, try it again. And just work your way up until you put it on and leave it on all night. I had a patient come in and say, wow, I made it all night on it. And I woke up and felt better than I have in a long time. Because it does, it increases your energy level, believe it or not. It actually can make your speech stronger as well. So the one that I talked about, the negative inspiratory force and the peak expiratory flow, those are two of the tests that when it gets below negative 60 centimeters of water pressure, or the peak expiratory flow gets lower than 180 liters per minute, that's when we know that we need to get the cough assist machine or the VEST, airway clearance system, implemented. There's a couple types of VEST machines, but the ones that we choose, they're reliable, and it's just because they were the first ones that got to me. How many has a cough assist machine? So, some of you do. The good thing is, Jim told me, he said, I use it every day, whether I need it or not. That's great, because you want to do that. It's good to hyperinflate the lungs, you know. That helps bring those secretions up. If you take it and you feel like you don't need it and you put it in the closet, then you end up getting that respiratory infection. You have a high fever, you feel terrible, and then they go and stick this mask over your nose and mouth, and the caregiver's trying to go, do I go this way or that way? You know, and you can't breathe in it unless they're in sync with you. So you want your caregiver to be familiar and with using it as much as you familiar with what it feels like. Because when you get that infection and you need that mucus to come up, you know, you don't want to be trying to struggle to learn a new machine. So that's why I always say, so good for you. Just listening.
It feels like it's pulling up a lung, but other than that.
But it'll clear anything out of there that you need it to.
Excuse me. Is that something that can be used before an infection comes about?
Yes.
Now, what is that machine called again?
The cough assist machine.
Cough assist.
Mm-hmm. That's this machine. And it sounds like a vacuum cleaner, because that's pretty much what it is. It's going to suck that stuff out of there.
It blows air in.
Yes, it does it. It inhales, giving you the breath, and then it takes it away. And as it takes it away, you cough. And as you cough, it sucks it out. The other machine that is implemented, most of the time with that one, will order the cough assist and the high frequency chest wall oscillator. That's the one at the end. And that's the one, does anyone have one of those? A couple? Okay. Does everyone know what it is?
No, ma'am.
Okay. This one, you use a little wrap. It goes around your chest like a blood pressure cuff. And then the tubing is hooked to it. And when it's turned on, settings are set. And when it's turned on, it's going to do this really, really, really fast. And I'll demonstrators.
Everything else. Like electric shocks up. Do you really want me to put it on?
We can in a few minutes. I'll let you all come up here at the end
It's a cough assist too, might as well.
and look at all the machines. And I actually brought literature on every one of them, so feel free to pick up something and take it home and read it. And it tells you all about everything I was going to go over. I did leave out one other tool that we have. We do the watch pat. And if you came to our clinic for the 2-day evaluation, I usually set it up on you that day, and you sleep with it that night and bring it back the next morning. We can download that, and the sleep specialist will read it, and then I forward it on to Dr. Brooks. And that's another good tool that will help us to implement the non-invasive ventilator early on. And it's really easy. It's not like these sleep labs. You go in and you're hooked up everywhere and you're in an unfamiliar place. You're not in your own bed. But this one, it tells us your sleep efficiency. It tells us if you are in just light sleep, if you're in a really deep sleep, or if you get to I'm way ahead of my notes. Light, deep, or REM sleep. And what it usually tells us is if you're having hypopneas, that apnea to hypopnea index, and that's really shallow breathing. And apnea is when you stop breathing during the night. There's periods of time that you can stop breathing. But everyone says, oh, I sleep fine. But yet they're yawning all day and they're tired and they're like, I don't understand why I feel so tired. And we do this test and no wonder, you're stopping breathing, you're waking up a lot of times during the night, you don't know why. And your oxygen saturation may decrease severely at night, and you don't know that. And that's when, the non-invasive ventilator can help, because most of the time you don't need oxygen, you just need that airway pressure. Just getting those lungs expanded to open up the alveoli, all the base of the lungs. Because when the muscles atrophy, your diaphragm is a muscle, and it keeps you from taking good deep breaths. And we all do that. When we wake up in the morning, we all yawn, and that's just to open that up. And if you don't have the muscle strength to do it, you really need to have something that's going to assist you, your breathing at night. And as Mindy said, the Trilogy ventilator is one that it's not only can be used all the way through, which helps the caregivers to be comfortable. You can use it throughout the disease process. If you choose to have a tracheostomy tube, you can still use the same machine. It's a very portable machine. It has internal and external batteries, so you can travel with it. It also has a way of doing mouthpiece ventilation. And if you look over here at Jim, he has it set up. It's just a little arm that has a mouthpiece on it. And if he needed to take a good deep breath throughout the day, all he has to do is reach over there and take a breath. So it can be set up on one ventilator. They can set dual settings, one for at night and one for during the day. But if you have a power chair, then we can order 2 trilogies. Have one at your bedside and one that stays on your power chair. So you're able to still go to the movies, go on vacation, and keep your quality of life up.
And this is mouth activated, so in other words, it's not running, it's running, but in the background until I put it in my mouth, then it helps me breathe.
Right, and the nighttime one's set up at very different settings. So, thank you. It's also called the sip and puff. And as you know, if you ended up getting respiratory infection, it's the most common cause of the hospital admissions in the patients with neuromuscular disease. So the reason I push everything and really push you hard to do these tests to the best of your ability is because we need to know when your lung's not functioning properly, because we really need to get these machines implemented and to get you to get to where you like them. Because most of the time, people will get them and then they will turn them back in. And then it won't be long till they go, I need that. So then we go through the process and get it ordered again, which we can. But it's just best to go ahead and try it as you can, at a slow pace so that you can get used to it. And believe me, we don't order them just to be ordering them. It's for a reason. And the one that we can put on mic in a minute and show you, it's the high frequency chest wall oscillator. It will move the secretions up the larger airways so that you can get the secretions out with a cough assist. That's when you have no cough at all. But I saw a bronchoscopy done while that machine was on the patient, and you could see those secretions just doing this all the way up. You could be lying in the bed, put that on, and it's moving them right up the airway. It's a fantastic machine. All it is a generator, but it generates that pressure to where it squeezes your lungs enough that it moves those secretions up in order to clear them out. So just give them a chance. You may use some of these machines and say, well, I really can't feel the difference. You may not feel the difference, but your spouse or caregiver may see a big difference in you. They may see that you're more alert during the day and you just are feeling better. I did have slides. I think that's it. Do you have any questions? Okay.
What could be the cause of a patient being tired even though they're using a Trilogy all night?
Well, that's a good question. The respiratory therapists, the home care respiratory therapists that come to your home, they need to come out routinely and do assessments because they may need to change the settings. If you're still feeling tired, sometimes it's just medication can make you feel tired. But
Even if it's just a sudden onset?
if it's sudden onset, it's usually not the machine. Could be something else. But sometimes they need to tweak it a little, either the iPad Max or the tidal volume, just need a little more volume. That's why the respiratory therapists are an integral part in getting you compliant and making sure that you're doing the best you can on these machines.
I would be tired and wake up with headaches before I was diagnosed, but with the Trilogy, I can't do that.
That's exactly right.
I put it on faithfully.
You need to tell a lot of other people that.
She comes out, and this week she changed the setting, and it's first time in a long time for this week.
Yeah, they need to come out and routinely check. That's why those therapists are very important in your life. And don't be afraid to call in to the office. They call me on my cell phone all day long telling me about the patients. I did such and such to this patient, and I'll write it down and note it and let them know about it in the Wednesday morning meeting. But I have direct contact with all of them. There's a lot of therapists out there. And you can call me or email me if you have any questions. And don't wait until the next clinic. If something's bothering you, if your mask is causing a sore on your nose, don't wait until it's a sore. Call us. There's something we can do about it. We can change that interface out. You can use even nasal pillows during the day, to get the pressure off your nose. Anything else?